Hello, everybody. Welcome to BIA for You for Them, our monthly podcast, where we talk about a condition that affects you, and we have an expert from the community who focuses on it and gives us their pieces of advice. This month, we have Dr. Babar Basir, who is the Mechanical Circulatory Support Director for Henry Ford System for Michigan. Dr. Basir is also a super talented interventional cardiologist and does complex PCIs or percutaneous intervention, fixing coronary arteries or arteries of the heart with stents. Today, Dr. Basir is going to talk to us about mechanical circulatory support devices that help the heart function when your heart gives up. What are the causes of it? What are the treatment options? And what are the things we must keep in mind? Dr. Basir, welcome and thank you for making the time.
Thank you so much for having me.
Of course. Dr. Basir, please tell us a little bit about what are the most common causes of heart failure or conditions that require such heart support devices.
Yeah, these support devices are increasingly used nowadays. The most common conditions that they're used in are number one, patients with advanced heart failure. And that's for patients whose heart muscle has gotten so weak over time that they are now unable to pump blood to their end organs, to their brain, to their kidneys, to their liver. And so they then are dealing with the consequences of heart failure. And typically, when medications are not enough, these devices are used to be able to help support people out of a common condition known as cardiogenic shock. And that's the medical terminology that we use when patients are not having a strong enough heart pump. Now, heart failure is the most common cause. The second most common cause is because of a large myocardial infarction or a heart attack. And these patients actually are even more in need of mechanical circulatory support devices because they have an acute presentation. They had a normal heart, and now they had a big heart attack, and their heart muscle has now, unfortunately, suffered a significant injury. It's stunned and weak, and it needs a little bit more help, again, to perfuse the rest of the organs while we give it time to recover. And the things that we use for recovery here are things like balloons and stents, sometimes heart surgeries, and then most importantly, four really important classes of medications that we use for heart failure. So those are the two most common reasons that we use support devices nowadays.
Outstanding, Dr. Basir. So it looks like if there is a heart attack that causes it, or a heart attack might cause it, or a blockage in the artery might cause it, have you seen any differences in females and males, the way they present with need for circulatory support device, or in the way you manage them?
Yeah, so we looked at this actually using some data from national registries. And like many things, it's very unfortunate that women receive these therapies less often than men do, likely because of some biases within treatment teams. And so women have under recognition of just heart attacks in general. And similarly, they have under recognition that patients are sick and in cardiogenic shock. And these are sometimes excuses that we give. For example, someone will say, oh, this woman probably has a lower blood pressure normally when they don't and they're in cardiogenic shock. Sometimes these devices are bigger devices that we use. And so there's a higher risk of complications if a woman's vasculature is smaller. So that may be a reason that people don't use it as often. But what the data also shows us that's very important to keep in mind is that when women are appropriately treated with these devices, they do just as well, if not better than men. And that's through data that we have from multiple registries as well now.
Aren't those fascinating? So it's really important to diagnose them and treat them correctly and also manage them aggressively, like the male counterparts. Very well mentioned, Dr. Basir. Do you have any points of advice that we should know, or the listeners should know, to prevent this condition?
Yeah, I think the most important takeaway for patients is that these technologies are readily available through major medical centers throughout our country and through the state of Michigan, and that it's really important to advocate for your loved ones. And so when treatment options are not working and patients are getting very sick, I think it's really important for patients and families to consider second opinions and transfer to larger hospitals where these devices are more readily available, particularly for patients who are younger and active or who are newly sick for the first time. We would be very, very aggressive about trying to treat these patients because we know that the use of these devices will actually help improve the mortality for select patients.
Thank you, Dr. Basir. It was great talking to you. A lot of important take-home points to advocate for yourself, to watch out for the symptoms, and when it's recognized, to have the treatment available or escalate to a place which might have that treatment available quickly. So thank you for your time, Dr. Basir. This was Dr. Basir talking to us at Via for You for Them on some very important points about mechanical circulatory support, which can be life-saving for a lot of patients. We will see you next month with another topic. Until then, take care and stay safe. Thank you.